my name's Corinne McCrum. I'm the User Involvement in Local Diabetes Care Project Manager. I work for Diabetes UK. The project is a 2-year project. It was funded by NHS Diabetes, and the purpose of the project is there's a lot of talk about involving users, but how do you go about it? It's not straightforward. Organisations need a lot of help, so NHS Diabetes and Diabetes UK together worked in partnership to set up this project, which was effectively a pilot project. So we worked with 3 different sites across the country. We asked organisations to apply, and actually almost a third of the PCTs in the country applied, 60 organisations. And the 3 organisations that we chose were NHS Lincolnshire, NHS Hammersmith and Fulham, and North Mersey Diabetes Network, which is Liverpool PCT, NHS Knowsley and NHS Sefton. The 3 organisations are very different. That was intentional because we wanted to actually look at what this user involvement, how it's going to work out in 3 very different settings. And the idea of the project was to actually establish systematic and structured user involvement that was sustainable over a period of time. So in each of those settings, we worked with a local coordinator and established a user group, and the idea was to look at the whole population of people with diabetes, and that the user group of approximately 25 people was going to be broadly representative of that population. So we wanted people of different ages, people with type 1, type 2 diabetes, people with different health conditions as well, people from different ethnic groups, partly because in some ethnic groups there's a lot higher incidence of diabetes. So in all 3 of those groups, in all 3 of the areas, the groups were representative broadly of the people living in that area. And we worked with those groups. The local coordinator worked with them and the organisation to explain what the priorities of the organisation were for diabetes care, and to actually ask the individuals what their priorities were for diabetes care. And over the period of the project, approximately a year to 15 months with the groups have really achieved a great deal in terms of their influence on the diabetes services for improvement. The reason I'm here at this event is partly to share the learning from that project, because so much has been learned from those 3 areas. What we want to do is we want organisations across the country to actually start involving their own service users. We've set up a website called the Making Involvement Happen website, which is on the main Diabetes UK website, and what that has got is, if you like, a step-by-step guide. So organisations who want to involve people with diabetes, how do they go about it? What do they need to do? What are the resources? It's all up there on the website. There's practical resources, there's video clips of people who've been involved, so hopefully that's going to be really useful to organisations who want to involve people. I think it's been a great event here. There's real diversity of clinicians, GPs, etc. And we've been really impressed that people coming to our stand, that they are really interested to involve people. So I'm hoping that the project and the website are going to be really effective.